So that's really the future of hair loss, is baldness. An interesting thing that we published, my group, I think it was in 2017, is that social selection favors offspring prone to the development of genetic alopecia. There's increased incidence of aging in younger population. And it's really interesting. Why are younger people actually experiencing AGA? I was the original guy who found a link in the CAG repeat and the androgen receptor on the X chromosome and the predictor of AGA in men. Well, but the women who can actually bear children at the later age are probably the ones that have the shorter CAG, which disposes their offspring to actually have AGA. There are quite a few women who decide that they don't, more than men, that decide they do not want to go through chemotherapy, which is life-saving, just because they don't want to lose their hair. It would be great if there was some sort of topical cream or something that we can apply to these patients before the chemotherapeutic session and see if they can reduce less hair. So one idea that we had is and I was involved in this, is developing an alpha-1 androgenic receptor agonist where it actually contracts the smooth muscle. Here's an example of a before and after with the patient, and a placebo, which cream that we use in this cream, which is kind of expected after a few weeks and a few sessions of chemotherapy. And this is one with the actin. The actin is just phenylephrine, which is an alpha-1 agonist. But you can see there's quite significant, we had quite a big series of patients that we have done this way, but there's quite a significant improvement as a prophylactic in hair reduction. Minoxidil currently is the only drug approved for female pattern hair loss. Unfortunately, it's a drug that doesn't work very well on majority of women. Only 30 to 40% of women respond. So we develop a diagnostic test that we can actually rule out who's going to respond or non-respond with almost 98% accuracy. How do we solve this excessive shedding? And I was thinking about glue at the time. How do you glue the hair to the scalp? So we developed a little project we started by applying alpha-1 agonist on it, and we tried to see whether it will increase the epilatory force required to remove the hair, and also while you brush or while you pull it, and also how much hair was shed. And lo and behold, this idea actually, it's a very simple idea, but it works. We were able to reduce the shedding quite significantly in some patients. And what we tried to do is what we do in vitiligo transplantation. We actually used suspension with the VitaCell kit. And what we do is we injected the suspension of melanin into the site. And what you find, this is one picture, that several weeks later, we did get additional pigmentation.
It leads to lower job satisfaction, productivity, and higher medical error rates, leading to lower patient satisfaction. How our products are always designed to help you scale. There is no capital expenditure. The risk is minimal, it is non-surgical. It's a highly versatile product. You can use it for multiple indications. It's a proven solution designed for outcomes. It is proven by research. It is 100% safe. It's almost painless. The patients will love you for it, especially if they've gone through PRP. It just takes 10 minutes. The patients are more compliant to the treatment because there's no pain and it's so fast. There's a better patient experience and you get a lot more good reviews for this. It is easy for your staff to convert and to prep. What do we do in this? We help you with onboarding, we help you with training, we help you with marketing, and we collaborate deeply for your brand building and scaling up. This is another initiative that we have launched recently, where we want doctors to create awareness among patients that hair loss is a serious business and you need to come to doctors for your treatment earlier on. The QR678 is not just a product, it's a system which is designed for you to be successful.
There is a need for the clinicians to collaborate more with the industry to understand what kind of research happens, and it is important for them to move away from what was the earlier standard of care to something which is relatively new, and how research and development can help come up with newer and newer products. So we've seen this upgradation happening from what was a different standard of care. It could be the minoxidils and PRP that will continue to be there, but they look for newer and newer ones that can help them address things much faster, that can help them give something which is much safer, which has got solid proofs, and thereby they are able to help them address the challenges that they are coming up with.
What really stands out is the patient experience and the patient outcome, right? When someone seeks a particular solution right now, they could find you on the internet, it could be a word of mouth or whatever else. I think the journey begins with them starting to discover you on, let's say, your website, right? Or by visiting your store. And nurturing the patient through the entire journey would clearly differentiate your practice.
But I think the next innovation would be where we can bring in some creativity along with the cure, what we're offering to the customer, right? Because people now know that, okay, I'm going to get this solution. But I think maybe this is the time where we need to start thinking that after that cure, I was into care business, now I'm getting into cure business. But after giving the cure, what kind of trend, what kind of creativity I can bring it to those hairs?
We see significant offtake for minimally invasive procedures. I think the QR678 demo just before this was, is very true for our practice. So we introduced this a while ago, and along with GFC, that's the largest kind of contributor to the hair side of our business in terms of hair regrowth.
The solution on the regrowth, the solution on the reversal of age, that is increasing. In fact, in our business, I forgot to mention in your first thing that almost 2/3 of our business happens in hair. And within hair, almost 30% business is driven from treatments and the solution which customers are asking from us.
Early interventions have a good scope rather than, maybe you can call it the care instead of the cure. There is a good scope for these kind of things to work very well. And that's where the services what is provided, whether it is the medical side or the consulting side, with whatever happens in the salons or in the clinic, make huge difference.
For growing hair, the first thing is it's a cosmetic problem we're trying to fix, and we cannot make it worse. We cannot make their hair unmanageable, and we cannot make it that it's completely dry or frizzy or doesn't match them or strip their color. So these are the issues that we really have to handle when we develop drugs, and I think injectables solve that problem.
What QR can do, and these biomimetic peptides definitely seem to have a role. And again, I've seen all the publications that have been done on this.